we have time now to have a discussion and the opportunity for people attending this event to ask questions to our panel members. I think that I know that Mandy has been checking the chat box during the event, so I'm gonna ask her to come in now and to highlight comments or if there is any questions that have been posted to our speakers. So Mandy, please.
Thanks, Carmen. Just a couple of things more, not really any questions as such. There are, just a reminder, there are a couple of links in the chat related to the Zero COVID Scotland, the Facebook page. There's a link there, and also the link for to join our mailing list so you don't miss out on anything that's going on from the Zero COVID Scotland campaign. There's also, Vicky has also put links in for the Research Aid Network's Long COVID Library. Should find some quite interesting reading there. I'm sure a few of you would like to maybe go in and have a nosy in there and see what's in there for you. Hayley has put the link in for the Unison campaign, and Ian's put the details in for the rally on the 14th of September, if anybody wants to take a note of those details. Mostly the chat has really been saying, I mean, David had said to Alison that she shouldn't be the one that should be feeling guilty for letting anyone down. It's the government that should step up and accept the guilt for failing all of us through this pandemic. Mostly the facts about doctors being reluctant to diagnose long COVID because it's not treatable, but it's also important that they don't just blame everything on long COVID and still consider other diagnoses that may be treatable, so that they're not missing other things as well. Just a reminder that the vaccination is not 100% effective, and obviously we now know that protection, it would appear, can reduce after about 6 months, so not a good sign for teachers either, being mixing with so many unvaccinated young people, and at the same time the fact that our young people are deliberately being infected, and this could have a huge knock-on effect for the long COVID going forward from here in young people. Rowena did ask Ian a point that he was making about the BAME community. I don't know if Ian Mullen would like to reply to Rowena in the chat directly, just to answer her question.
Yeah, I'm gonna interrupt you now, sorry, because for that, I mean, I'm happy for people to use the virtual hands and to wave at me in the screen. I might be able, the problem with waving at the screen is I might not be able to see you. So I have a hand now from Mike. So Mike, if you want to go ahead, please.
Thank you, Carmen. I've jumped the queue a bit because I wanted to say something about the people who we were expecting to speak this morning, but haven't been able to get here, because I think it's quite significant. But I mean, first of all, let me say a big thank you to all the people who have managed to get here despite extremely difficult lives. I mean, we've heard some of the strongest and most compelling evidence I've ever heard for the need, as Stacey said, the only way, and others have said the same, I think, the only way of protecting children particularly, but all vulnerable people, all of us, the only way is to eliminate this virus, and there isn't another way. And I think the evidence that you've put together today is extremely strong. And then I want to say a big thank you to Carmen, not just a sort of, thanking everybody, but because Carmen is so good at picking up and identifying with each speaker, and the words she said after each speaker, have so strongly expressed the value we place on their presence here and their determination to make their voices heard. So, Carmen, you're very good at this. And then I want to tell you about it's really 3 or 4 people who we had hoped would be speaking here. And just very briefly to say that why they're not here, really. First of all, there's Peter Doherty, who's GMB convener for McVitie's, who's not only been fighting a campaign against redundancies, which is related to the whole thing. But also they had a terrible outbreak at McVitie's, and had enormous difficulty with their employers to make to make the workplace safe. And but I know he's just so busy he can hardly think, and it's been a very, very difficult many months for Peter. And he's not here. He said he would be, but he's not. And then secondly, I think it's very significant that at one point or another we have had 3 people lined up from accident and emergency departments, workers in accident and emergency departments, 2 nurses and 1 support worker, support health worker. And the life of these people in accident and emergency, I've picked up from them and others, is appalling. They are not underworked, understaffed, and hopelessly overworked, with huge queues in casualty, especially when restrictions were lifted and people just went to casualty, not having been able to see a doctor for so long. Some patients, I don't say all or the majority, some patients are being extremely rude and dismissive to the workers about the need to social distance in the waiting room and to wear masks. And that's an extra trouble. And then, of course, they're hugely exposed to COVID. And the latest person to drop out was Charlie Miller, who's a support worker in A&E. And I had a message from him at the beginning of the meeting saying he was in his own casualty department with his grandson, whose breathing is very laboured. I don't know what age his grandson is, whose breathing is very laboured, and they're trying to get him seen quickly. And even Charlie said, "I'll try and join later, but I don't know how long I'm going to have to wait." And then finally, there's Finlay Baxter, who's a young person who was going to speak about the difficulties he's had as a young person leaving college, trying to find a job, and trying to afford somewhere to live through finding a job. And he's not here, but I know he's working. He's now suddenly found a job just over the last few days, and he's working very long shifts, and so I know that his life is very difficult. So I think it's important that I just tell you about those people who could also have added to the list of evidence today. I think there is a solution to this, and we will be inviting these people to record what they would have said and to add that to the recordings. And I think you people who've turned up, your message is going to not end here. It will be spread far and wide. And then lastly, please, could I just ask Rob Connell, who spoke so well as a teacher, if he could have a look in the chat where there's a message from him about an interview after the event, if he's able to do that. Thanks.
Thank you, Mike. So far, I cannot see any people wanting to make questions. I'm going to give again the opportunity to people to ask questions, raise hands. Okay, we have, I cannot see, Mike, that is just your same hand from before.
Yeah, sorry.
It's okay. I'm gonna abuse the chair a little bit. I have kind of 2 questions I would like if someone can answer to me. It's like for especially for people that have experience with long COVID, it's like what is their opinion about these COVID clinics? That is my understanding that they have been in place in England, but in Scotland we are not yet there. And whether these clinics they should have like a kind of a specialist for children as well, since Sammy was talking about that, the children were at risk, and it's something that maybe we have not been fully aware yet. So I would like if anybody wants to come to comment on this. I can see Sammy's raising the hand. So Sammy, please.
Thank you. So our experiences so far of the long COVID clinics aren't great because, of course, there's no treatment yet and we don't have an established clinical definition. So it can be very helpful to have validation of your condition. It can, there can be some initial support. And of course, there may be some symptoms that can be helped with that are similar to other conditions, and symptoms can be alleviated. So they are important. They're recording the data. They're starting to establish the true extent of the problem. But I do think it's really important that we understand that actually getting a referral is very difficult. And once we get there, the general consensus has not been very satisfactory. So, and the children's ones, of course, are so new that we don't really yet have good feedback to report. Thank you.
Okay, thank you. And I don't know if Vicky, do we have any kind of what is in the Netherlands? What is do we have like something like COVID clinics? Or are you from the Netherlands, or I'm getting this wrong?
Yeah, I am from the Netherlands. In the Netherlands, there are no actual long COVID clinics. There are some clinics that have turned their focus on long COVID, but they're by heart, there's only 2. And the treatment that they offer is not actually the type of treatment that they need. So we've been hearing a lot of reports of people being offered graded exercise and cognitive behavioral therapy, which can be very harmful to patients. It can help some, but it's not something that can actually make us better. So in the Netherlands, there's still very much a need to establish these clinics to get that up and running, and we're advocating for that with my work group, Long COVID Netherlands.
Okay, thank you, Vicky. I can see Ian, have your hand up, please.
Yeah, thank you, Carmen. I think maybe Andrew would have more information on this, but I read a report earlier in the week, or an article should say, that this was something that the national government was looking at setting up throughout Britain. But I really do think that the time has passed to put proper funding and resources. They should have been doing this months and months ago, and looking into the long COVID situation, because at the moment we do not know exactly the numbers of people, both young children and adults, that are suffering from long COVID. I know that both my wife and my sister-in-law work in special needs schools in Edinburgh, and long COVID, there was 14 cases in Cairns, and my sister-in-law was one of them in a week. She has now been diagnosed with long COVID and fatigue syndrome, and although she works 40 full hours, she is back at work doing 3 hours a day at the moment, and is really shattered after that. So I think that more research has to be done, and more support has to be given to people that are diagnosed by workplace managers. I also think that there is a serious issue with our occupational health advisors, who do not seem to have adequate advice and understanding about the effects of long COVID, and particularly fatigue syndrome. Thank you.
Thank you, Ian. I have a message. I have a message for Pete saying there is a question in the chat from Hannah, but I cannot find it. So Pete, would you be able to read it out from the panel, please? And then I'm gonna get Gary next.
I can do it, Carmen.
Okay,
I was just
thank you,
messaging
Mandy.
you.
Oh, sorry.
Hannah has a question for Stacey. She has an invisible disability and clinically vulnerable, but wasn't on the shielding list. Her household don't do anything indoors, don't mix with others because they just don't feel safe. People often gaslight them and tell them that they're over anxious and they need to get over it and get on basically with their lives. She would like to know, how do you cope with these pressures? And do you have any optimism that the policy of mass infection will change anytime soon? She's meant to start uni this month, and she's absolutely terrified. If Stacey wanted to reply to that, that'd be great.
Yes, of course. First of all, Hannah, I am incredibly sorry that you are being gaslighted like many vulnerable people. You are not over anxious, and the statement of you just need to get over it and live our lives. The ability to get over this and live our lives is totally dependent on government stance changing and conditions being made safer. How do I cope with these pressures? To be honest with you, it's by channeling it and doing events like this and speaking out on Twitter and challenging the narrative. The pressure at home with regards to keeping our boys safe and myself is immense, and it is stressful, and it is sometimes very scary. If we have a hospital appointment that one of the boys has to attend, I won't say anxiety, because the word anxiety is very much overused with regards to vulnerable people, but not quite, I want to say gut-wrenching fear, really, of walking an extremely vulnerable 6-year-old through a hospital to have an x-ray is horrendous. And funnily enough, he's due one tomorrow, and I'm pretty sure I won't sleep tonight, but I'll come home from that tomorrow. We will do our usual bath, clean clothes, everything gets put in a bag and put straight in the washing machine routine, and then we will challenge any nerves that we have and say, right, well, okay, we've done what we can, let's focus on the boys and what we're doing. Now, that's not easy for everybody to do, but what I would say to you to do is find something that brings you peace or comfort, a hobby, anything like that, and channel how you feel into that. Channel how you feel into stating how you feel openly in places like Twitter. Don't be afraid to have people challenge you, because as a vulnerable person, we have worth and our voices are important. Your voice is important. With regards to the policy of mass infection, I do think it will change, because the louder we are and the more events like this happen, the more that this narrative is challenged, they will have to start listening, because we aren't going anywhere. So I can't say when that will happen, but I'm confident that it will do, because if they don't listen to us talking, we'll start yelling instead. I invite you to join us with regards to our Facebook group. We are a relatively small group of just over 1,000 people, but what we provide is a safe space, and you will be able to talk about your experiences and how you feel in that group safely. So I'll make sure that I drop the link to our Twitter in the chat, and that then has a link to our Facebook group, and anyone who is clinically vulnerable and needs a safe space, you are more than welcome to join us in one voice. So hopefully I'll be able to talk to you more on the subject outside of this event as well. But with regards to starting uni this month, do not be afraid to speak to your university and tell them what protections you need, and ask them what they can do to support you and what they can do to help protect you.
Thank you very much, Stacey, for the advice, and we will follow it. Next person with a hand is, I have a couple of people with a hand raised, and there's a couple of questions in the chat as well, but I'm gonna get first Gary Hatt, please. Anybody from our panel that want to come up to answer that? Maybe Ian or Professor, yeah, Andrew, please come in, please.
I think Rob hopefully will say something about this as the teacher, but I think there really is a big mismatch now between the voices that we hear and the government policy. So I think the STUC, Unison, the teaching unions have been pushing the line, but it doesn't seem to be being heard. As Stacey says, it's a case of constantly pushing that. But the argument that's actually coming from the Scottish government now is it's more harmful to keep mitigation than pursue it. And all the evidence is actually the exact opposite. So unless we have added mitigation and return to the sort of measures we had in spring, we're going to constantly see these problems. The extent to which the unions can be heard, I think it's probably true to say in Scotland, they have more of a voice to the Scottish government, but whether the Scottish government listens fully to them is an entirely different matter. And I think the evidence that we have got in terms of what they seem to be planning to do now is that they aren't listening. I mean, we're going to have to see what comes next week or so, but the Deputy First Minister's indication is, you know, that, well, we'll effectively, it's not his words, but effectively they're going to let things rip even more. And that will damage, you know, the economy, society, it'll damage the health service and so on. I mean, Stacey, Ian, Sammy, Rob, Sally have all made the point that we've got a huge problem dealing with long COVID, but the key thing is to prevent it. You know, so that voice, I think, needs to come through the trade unions, the NGOs and so on, even stronger. And I think, you know, the mainstream media, people like Peter Swindon and so on, are an important part of that. Sorry.
Thank you very much, Andrew. Ian, do you want to come in to answer this question, or you have another? Ian,
yeah,
you want to come in to
wasn't
answer?
sure if there's Rob before me.
It's just if you.
I think Professor Waterston is absolutely correct. We are. I know that Alison Murphy from the EIS is on this call, and we work closely together with the management team, the operations team for schools, who have been really good all the way through this. But the simple fact of the matter is that right from the get-go, when we came back to schools last August, you can put all the mitigating safety measures in that you want. There is never going to be social distancing in schools, and especially in special needs schools. We started recording the infection rates, and when we talk about schools, it's not only teachers, it's all the FM staff, it's all the support staff that need to be remembered as well, because it's affecting everybody. But you know, you put in as much hand washing, sanitising stations, signage, it's just not going to happen. The Scottish Government's guidance is fundamentally flawed, and I've said this to three senior, I've attended 3 meetings this week with senior management, including schools on Thursday. You cannot take Scottish Government guidance, and I used the scenario of Edinburgh, Glasgow and Dundee, 3 of the biggest cities in Scotland, and use that same guidance for somewhere like Coburn, Mull, Skye. We have 6,500 members of staff in schools in Edinburgh alone. There are some towns and villages in Scotland that don't even have that as a population, and yet we're expected to use the same guidance. And the worst thing is that local authorities are not willing to actually, as I said yesterday, look at their local scenarios, the economic, the social aspect of things, the transmission rates within the local environment, and the actual working environment itself. And Professor Waterston spoke earlier about ventilation in schools. You know, this all has to be taken into consideration, and I think that I actually think that head teachers and business managers and school staff collectively should have a say as to whether they are going to partially or fully close a school and take that directly to their chief exec or their senior management, who seem reluctant to actually deviate from Scottish Government guidance. Thanks.
Thank you, Ian. I'm going to take next, I think it was Mike, for a question or comment. Mike, please.
Thanks, Carmen, but let Grant go first.
Okay, Graham, please, can you come in?
Yeah, thanks. I'm branch president of UCU at the University of Edinburgh. I was out of the room briefly, but I heard somebody referring to the situation in universities, so I thought I'd come in and make a few comments. The semester that we're just about to go into really alarms me. I think we saw at this time last year that the vast movement of students around the country resulted in huge spikes in COVID. This time around with Delta, it will affect the demographic that makes up the bulk of the student population in a way far in excess of what it did last time. And yet we've got then, certainly in terms of my institution, and I'm hearing echoes of the same from colleagues in other institutions, that university management have learned absolutely nothing from what happened last time. In fact, there seem to be doing in even more of the same, because the Scottish Government guidance now is far weaker than it was this time last year, and their approach seems to be to do as little as they possibly can get away with, while staying in line with this weakened guidance and the law, and then just wait and see what happens. Well, we know what's going to happen. And I think for people who have got who are at university or have family at university, this is actually a very scary time approaching us. I've nothing more, no pearls of wisdom to impart on that, other than I think people need to exercise a lot of caution if they're involved in higher education at the moment, because I think it's going to be a very dangerous place.
Thank you, Janet. Thank you. I think it's one of the things, how much are we learning from the previous waves, and how much we can implement to improve impact. So thank you very much. We'll take Mike down now. Mike, please. You are muted.
Yes, sorry, I'm here. I was just trying to email one of the people who's not been able to get here. I just very briefly wanted to pick up something which Sally said, which I think is very powerful, and that is lifting restrictions is lifting protections. And she was saying this quite rightly with respect to and on behalf of disabled people, but actually it's the same for all of us in different ways, and that's what's really come out of this meeting. In so many different ways for all ages and abilities of people, lifting restrictions does represent increased risk to us all. And I think one of the problems we have in this campaign, and we still haven't really found a way of solving it, I think, is that the words restrictions, and even worse, lockdown, are words which people at this point, after more than 18 months of the difficulties we've had, are abhorrent words to them. They associate them with going back to a way of living which was intolerable for many of them. But I think there are two important things that we have to get across about this. One is that actually, as the knowledge about this virus increases and the research studies come in, and with the help of vaccinations, it isn't the same problem as it's been in the past. It's a problem which is much less than the word restrictions might suggest. But also the thing we have to get across is that actually to pursue an elimination strategy, which the Scottish Government was attempting to do at one point, to really pursue that and stick to it, will lead to much less restrictions than this stop-start situation we're in now. I mean, in a week's time, I cannot imagine that the Scottish Government will not be introducing some sort of new restrictions. So, and lastly, I don't want to put Jeremy on the spot, but Jeremy Rossman, from whom I've learned and we've learned as a campaign so much, I see he is here now, and maybe he might like to say something about how we can get across what restrictions really mean now, in a way which meets people's needs and understanding. Thank you.
I think Jeremy Rossman, it's Jeremy Rossman, you say, is here, Mike? Yeah? Yeah. I think there is a...
Sorry, I think he is, yes.
Okay. I can see there is questions in the chat and hands raised. So I'm gonna let Jeremy Rossman speak. He's a virologist we're speaking to us from Chicago, and it's kind of a different hour there, a different time of the day. So we really appreciate you being with us today. And then if there is time before the closing up, I will take more questions from Sarah and Wendy. But now, Jeremy, if you want to speak to us, thank you.
Yes, thank you. I just wanted to say that, you know, I think how you get this across is exactly what this meeting is designed to do, that it's listening to the people, it's hearing the stories, it's also looking at the data, because so often what we're hearing about is focused on the fact that we are having lower rates of COVID fatalities or lower rates of hospitalizations due to the vaccines. And this is all very good news, but it dismisses so much. It dismisses the impact of long COVID. It dismisses the impact on children. It dismisses the impact on the clinically vulnerable. So we need to be communicating this. We need to be clearly communicating the risks. For instance, the JCVI in their assessment of vaccines for children really were not touching at all on the actual risks to children of the virus. So I think it's a matter of making sure that, you know, we have these stories, we have meetings like this, we communicate the patient stories, understand what the real risks are, and make it clear that we know exactly what to do. It's not a matter of saying, you know, we have to figure out how we mitigate in schools. We know the virus is spread in the air. We know how to stop virus being spread in the air. So it's a simple tool set that we have. We just need to be able to apply it.
Thank you very much, Jeremy. I think the point you make about this dialogue between, you know, kind of professionals and scientists and people in the society that are actually suffering the impact of COVID is really, really important. Thank you. Thank you for your contribution. I will take now Sarah, please.
Hi, yeah, sorry to probably shouldn't raise this question near the end of the meeting, but it's following on from the person that spoke based in England asking about, you know, what the trade unions doing. I think this is a crucial question, really, because I think it can paint quite a sort of hopeless and depressing picture if we feel that you know, that the landscape is looking grim, and we're not sure how to turn it around. And whilst I think obviously people, trade unions can talk to the government and raise their concerns, I do think we get back to sort of the basics with trade unionism, one of those basics being that we don't send our members into situations where they can get seriously ill, long COVID, or potentially die. And that is still a reality that we're facing, let alone if you're in a school, all the students, or a care setting, all of the resident care. So I think we need to think about, you know, we do have, despite now the individualisation of responsibility, which is a strategy being pursued by governments north and south of the border, that the trade unions have an ability to raise the collective voice. Not just a collective voice, but think about collective action. I remember, if you think about it, it's always been collective action that has led to things happening. At the first wave, with schools closing down, it was because parents, and I was one of them, refused to send their kids into a school setting anymore, at which point the governments reacted and closed the schools. At the beginning of January this year, again, the government pushing students back into school. It was when the National Education Union decided to call its members together, said, we are not going back into school. They held the biggest online union meeting, I think, in the history of union meetings, and massively recruited to their union and refused to go into schools, and that forced the government. I do think we need to think the government is on a different trajectory. The government is no longer on an elimination strategy. It is making the case, it's decided that keeping the economy open is worth a certain amount of death. Unfortunately, that is the reality we're in, even in Scotland. But I do think we have to look back to our unions now, in Unite, the EIS, the SSTA, the other UCU, and start to think about, have discussions at branch level even. How safe are your members feeling? How are staff generally and your students feeling? And start to think about the ideas of what we can do, because I think, unfortunately, it's not going to be through pleading or asking the government to do what we want it to do. That's never how trade unionism has worked over health and safety. We've had to force it. And I think this is you know, we've lost so many lives already. I think we need to think about how we collectively start to wield some of that power again and try and turn the tide around on this before it's too late. Thank you.
Thank you very much, Sarah. I wouldn't take that as a question, but as a very powerful statement. So thank you very much. I think we all in this event today agree with every single thing that you said. So thank you very much. I'm going to take now Wendy Watson, please. Walton, sorry.
Hi there. Hi. I just wanted to speak briefly about the shielding service because I heard Sally Witcher actually. Yeah, I'm a welfare rights advisor. I work for Edinburgh Food Project. I'm here on a personal capacity. I've been in post in my job since January last year. I was due to go out and work, and we run 8 food banks across Edinburgh City. Given the COVID, I was asked to run an advice line, and rather than, because of COVID restrictions, obviously we couldn't have people going into food banks, so we actually operated a delivery service for about 5 to 6 months during the COVID pandemic. There was leaflets going out with food parcels and just asking people to get in contact with myself, advice line for some welfare rights advice or debt advice. Through that, I was able to pick up quite a lot of vulnerable people who had been sent shielding letters from the Scottish Government, were asked to text for a box of food. In some instances, I'd actually come across people, elderly people that were vulnerable, people who didn't have digital access, so weren't able to actually text the number and get access to the food from the Scottish Government. So I'd actually referred quite a lot of people to the local council's shielding service. People were obviously using the delivery service was really useful. Obviously, a lot of people who were diagnosed with COVID, having to isolate, etc. Fast forward to now, our food banks are actually open, and the shielding service has actually been phased out, sadly, since October, it seems, last year. My experience at the moment is we're actually running a separate sort of pilot scheme with the Scottish Welfare Fund at the moment, which has been phased out, thankfully, at the end of the month, whereby myself, my colleagues, we actually carry out the food referrals on behalf of clients that are actually phoning the Scottish Welfare Fund and maybe being refused a crisis grant for whatever reason, and then being referred to us for a food parcel. What I'm actually finding on the ground is a lot of people are being asked to self-isolate from the track and trace system, or they've been diagnosed with COVID, but there's no shielding service, there's no delivery service. Now, if you factor in, obviously, well, the COVID uplift is about to be removed next month from universal credit. People on low income, people have lost their jobs, etc. Are struggling to purchase food, or they don't have digital access, they can't actually buy food online. And these are people who could be classed as vulnerable, if you like, but they've got disabilities of whatever description. The point is there's no system around to help folk at the moment. We're no longer running a delivery service rather. So it's actually creating, it seems, quite a lot of conflict between some of the third sector organisations. I'm not going to mention any names, I can't. But it just seems like, from my point of view, the Scottish Government no longer gives a shit, to be perfectly honest. The remit is for people just to get on with it, find a job, and the economy's open back up again. So it's really, really disconcerting for myself to try and ameliorate the effects of that. So yeah, I just really want to just point that out. From my point of view, it's really hard on a daily basis dealing with cases like that. There's not a lot I can do because there's no services around. I can say from my employer, there's an actual arbitrary rule of we're only allowed to issue 3 food parcels to people unless they're working with another agency, which sadly I've had to put my foot down on that one and challenge my employers on that. And I've managed to pull that one back, thankfully. But the bottom line is, in terms of, well, the ongoing crisis that is the pandemic, people are still being diagnosed with COVID. There's no statutory bodies there to support people. It really has just been put on the shoulders, if you like, of some third sector organisations.
Thank you, Wendy. Thank you very much. Sorry to kind of interrupt you there. I'm aware of kind of the time. I think you are right. I think it seems that some governments have almost gave up on fighting COVID. And I mean, it has forgotten that COVID is still there and it's really real and it's still affecting people. So thank you very much for your speech. Now I just gonna take one more. I'm gonna ask Sami to come in because there were some questions in the chat regarding the FOI. I apologize, Ian. I won't be able to take the raise hand, and please, you are really brief. But I'm gonna take Sami first. Okay, Sami, please.
Thank you very much. So when we wrote to all the local authorities in Scotland and asked them what they were doing to spend the funds that had been allocated for mitigation measures in schools, we really expected to get a lot more information back. And what we saw was the huge disparity. And I'm listening to everybody's concerns about transmission and in the community, you know, as well. And the way that we're going to tackle that is by tackling the transmission in schools. So I just thought that it's worth mentioning that the Stirling Council, for example, hasn't even come back with a response, and we've requested that numerous times now. They're well overdue to respond to that. And we've got you know, councils like the Shetlands and Angus. They've got they've been proactive, got meaningful improvements in their ventilation mitigations, but other councils like North Lanarkshire and Scottish Borders, they've made no improvements. So we really need to be focusing in on how we can to get these schools to start listening to the ventilation experts. And we actually produce a free resource, which is a school pack. You can download it from the front page of our website, and it's evidence-based and referenced for the reader's benefit. And it can be used as a tool to highlight ways that people can reduce their risk, and also how schools and indoor spaces can be improved. And we are working with a company called Better Indoors, who are collaborating with us to try and bring this information to the forefront of parents' minds, to schools' minds, and to really ensure that less people end up as sick as our children. Thank you.
Thank you very much, Sami, for giving us this overview of the FOI information. We have our last speaker, Janet Newsham from Scottish Hazards. So it's going to be like a kind of the end of the event. Thank you very much. Janet, please.
Thank you very much. I'm from the Hazards campaign. And we've got some good comrades in the Scottish Hazards. We work alongside Scottish Hazards. So I've been asked to just sum up what's been said today. And there's been some fantastic contributions, very harrowing and thoughtful and thought-provoking. We started with Andy Watterson, talking about why this is an important event, talking about the lived experience of how people have dealt with COVID, and asking lots of questions which our politicians and our representatives should be answering. Questions about ventilation. We've heard a bit about ventilation just now, but you know, why are they concentrating on CO2 monitors without improving the ventilation in our schools? Why are people still confused about what is meant by that? Why social distancing isn't being maintained? And why there's no workable public health policy in Scotland? There isn't across the whole UK, I don't believe. We heard from Jane, who talked about, who said that early on, if you weren't tested, then you weren't counted and you weren't treated, and graphically described the impact of COVID on health. And it wasn't, and I don't believe it's good enough that people should be having to resort to private health, because that means that it's only people who can afford it that can use it. There's certainly lots of issues around the healthcare of people. We heard from Anita, who talked about surviving lockdown and that experience that she and others have had to make, you know, the choices that they've had to make sure that they could still function after we've come out of the pandemic, and we're miles away from there yet. We heard from Keith Patterson, who talked about the effects of COVID and the restrictions and anxieties on the LGBT community, and why there's more vulnerabilities, the more likely social isolation, the less likely support networks, etc., poor mental health, and all the other impacts on the LGBT community that we need to address. We heard from Alison Ross, home care provider, and the harrowing traumatic experience and account that she gave us of the experiences of care workers, people not medically trained, but are having to be on the front line without proper PPE and proper support, without the proper communications and information about how they could function safely and keep their health of themselves and their families, and how they're severely short-staffed. And it's that's a long-term issue, isn't it, in terms of how we can improve care, social care. We heard from Vicky, reminded us that there's only a handful of countries that are even acknowledged acknowledged long COVID, and certainly not providing the healthcare needed, or the financial support that's needed, or a diagnosis of long COVID, and how it's an education is needed for all healthcare professionals to help to be able to support and in addition in a multiple of languages. There's few guidance that can be printed, but we have to raise our voices to support people with long COVID. We heard from Rob and the anxiety of teachers, not only to themselves as a profession and all the staff and other school staff, but also, about the horrific thought that children are being purposely infected with COVID, and the refusal to vaccinate our children. But that health impact in the schools, the lack of mitigation that's in there, is certainly something that's run through the whole of the event. We heard from Sally, who reminded us about the impact on people with disabilities. And I think, the fact that she said that, and I thought something that came to mind was the anti-vaxxers who are not freedom fighters, but deprive us of our freedom. And she said, about the response, she showed a catastrophic, the responses to their survey showed a catastrophe in mental health, the problems accessing food, medicine, health appointments, and unpaid carers were on their knees, and our social care systems collapsed. And we need to address that. We heard from Ian Mullen, somebody I know and work with through the Hazards campaign, and absolutely thank those trade unionists that are involved in this and the work that they've been doing tirelessly to support members in work, challenging bad employers. And he graphically illustrated the issues that they were facing, including the issues around Black and ethnic minorities. And we should give support for the rallies that he talked about, and support the one on the 14th of September. And also the issues that they're going to face in the future. We heard from Sammy McFarland, the desperate and terrifying story of her daughter's experience of COVID. And as parents in this call, we could all relate to the things that she'd experienced. But absolutely, the message at the end, the need to prevent long COVID is a need to prevent COVID infections. How do we prevent COVID infections in the first place? And there needs to be more awareness about it. And Stacey McCann, who talked about the gross negligence and morally repugnant governments that we've got. No one should have to choose between school places and family health. And, absolutely support her. We are all in just one, the quote at the end, we're all just one severe illness away from being the next vulnerable person, and we should all remember that. So we, as I finish, I'd say Rory O'Neill is the Hazard magazine. Look at the Hazards magazine, by the way, because the Hazards magazine contains lots of information about how you can, how we should improve and how we should have mitigations in all our workplace settings, in all inside spaces. School settings are not anything other than a workplace, and the mitigations that are needed are just the same as any other workplace. Have a look at that. Have a look at the ventilation advice in that magazine. He said in the Hazard magazine, the pandemic didn't cause our occupational health crisis, it exposed it. And what's clear to me is that for decades of underfunding, destaffing, undermining, and the creeping privatisation of our health safety enforcement, the NHS and the public services has left us with a broken and desperate society. COVID's exposed the callous, calculating, exploitative ethos of a class that values privilege, greed and selfishness above our lives. A class that devalues health and normalises the early deaths of thousands and the long-term ill health of hundreds of thousands, including that of our grandparents, our mothers and fathers, our children, our relatives, our friends. All lives are being put at risk by a neoliberal government and their insatiable drive to cut regulations and prioritise profit. I applaud and thank those organisations represented here and the challenges that they're facing. Thank you so much for sharing your stories. You've been inspiring, and we need to change all the narratives out there. We need a different direction. We need a zero COVID direction. We need repression of infection and control. We need to prioritise lives above profits. And we need our governments, whichever governments that we're under, and say to the Scottish Government, you know, we absolutely need them to use the leverage that they have to put influence on the UK and to Parliament in the UK, in England. You know, that this is something that we need to all work together. I think Mandy said, no, sorry, somebody said at the end that about unifying, about collective action. And absolutely, this is about collective. We need a collective response that shares all our experiences and we all work together to try and influence and change what's going on and challenge what's happening. So thank you very much.
Thank you very much, Janet. Amazing way to summarize the event. If I would pick up one thing, is like life before profit. So thank you very much for you summarized perfectly all that we have discussed here today. So this is the end of the event. I just would like to thank all the panel of speakers for coming here and sharing with us your views and your experiences. Thank you very much for taking the time to do so today. And also, I would like to thank all the people that have attended the meeting today, to taking this Saturday morning to share with us and to contribute to the event. I apologize that some questions in the chat didn't get to the panel. There's unfortunately a limit of time, but I just think it was a magnificent event. Thank you very much all for coming, and I see you next time.